What's going on, everyone? I'm Tremel Thompson, and welcome to another episode of Where is the Lie? Now, in this episode, we're going to talk about the retiree healthcare benefits and the union basically selling the retirees out. Now, I need you guys to understand something. Do not think that this only affects the current retirees. If you're working for the MTA right now, you're a retiree that just didn't retire yet. So whatever affects them right now will affect us in the future, right? That's why it's very important that we start the fight back now. And to the retirees, I want to say this to you guys. I've seen plenty of posts. I have plenty of conversations with people who retired, with people who's close to retirement, and they echo that same narrative of we fought our fight. We fought for the unborn. And I tried to tell them time and time again, you can get sold out too. And look what's happening now. They are being sold out. Now, the union is trying to put up this fight and saying, well, the benefits with the Medicare Advantage from the city benefits to our benefits aren't the same and things of that nature. And I actually want to read to you what the union is saying. This is not the city plan. Far from it. There's no comparison. The coverage for our retirees is far superior. Part of the reason is that we have had options 1 and 2 for more than a decade with locked-in standards and requirements that the coverage and service cannot be diminished. Aetna can now put in hoops to jump when those hoops have not been there for all these years. Now, that may very well be true, but the union is leaving out a very important component of this whole Aetna Medicare Advantage thing. I don't care if it's 1, 2, or 100. Is that Aetna is a for-profit company, which means that they only care about their bottom line versus your health care, which means that the doctor do not have the final say in your health. The insurance company is, because as a for-profit company, their bottom line means more than your health. In fact, let me explain to you guys what a for-profit company is. Now, I found this on the net. It says, how do insurance companies make money from healthcare? The main way that an insurance company makes a profit is by ensuring the premiums received are greater than any claims made against the policy. This is known as the underwriting profit. Insurance companies also generate additional investment income by investing in the premiums received. So basically, what they're saying is, for an example, if your premium, and I'm going to use small numbers just for the argument, if your premium is $100, the insurance company do not want to spend $150 for your health, right? Because that means that they will be a negative $50 in the hole. So the goal of the for-profit insurance company, if your premium is $100, then they want your services to be probably $50, so they can have a $50 profit. That is the goal of the whole entire insurance for profit thing. Now, let me explain to you guys what the underwriting profit means. Check it out. What is underwriting profit? Underwriting income is the profit generated by an insurer's underwriting activity over a period of time. Underwriting income is the difference between premiums collected on insurance policies by the insurer and expenses incurred and claims paid out. Once again, to put that in simple terms, the goal of the underwriting profit or the underwriter of the insurance policy is to make sure that the health care that is billed to the insurance company does not cost more than the premiums, because that means that they will be operating in a deficit. The goal of a for-profit insurance company is to make sure that the premiums surpass whatever is written or whatever policies are covered. It's as simple as that. Now, this part of the business should not surprise you either. Being that Aetna is a for-profit company, you can also buy shares of Aetna. And the shares of Aetna right now is currently $212. That's more than a lot of Fortune 500 companies. So that should tell you what type of business they are doing when it comes to healthcare. but it gets deeper than that. Let's get into it. The New York Times actually did an article back in 2022 regarding the Medicare Advantage plans and the troubles with it. Let's check out a couple of the quotes from the article. One quote says, "The report echoes similar findings by the office in 2018, showing that private plans were reversing about 3/4 of their denials on appeal. Hospitals and doctors have long complained about the insurance company tactics, and Congress is considering legislation aimed at addressing some of these concerns." Another quote says, "People should know what they are giving up," said David B. Honig, a healthcare lawyer and Mr. Parker's son-in-law. "People signing up for Medicare Advantage are surrendering their right to have a doctor determine what is medically necessary," he said, "rather than have the insurer decide." In the final quote I'm going to pull, it says, "In another case, a patient had to wait 5 weeks before authorization to get a CT scan to assess her endometrial cancer and to determine a course of treatment. Such delayed care can negatively affect the patient's health," the report noted. So it's quite clear. Medicare Advantage deny patients their health care. They have the final say. Now, I don't understand why the union will move towards this. Maybe it's because of their love affair with Mayor Eric Adams. Maybe it's because they are weak. I have no idea. But there's more information regarding this. And this comes straight from the contract. So let's check it out. Now I'm going to read part of the stipulation and agreement. "It is hereby stipulated and agreed by and between the parties hereto, effective immediately, that there shall be created a joint employee health benefits committee with the composition, schedule, and responsibilities set forth below. Composition: New York City Transit, VP Office of Labor Relations, VP of Human Resources, and Employee Benefits Director. On the union side, the President, Secretary Treasurer, Member Services Department. The meetings: meet every calendar quarter or more frequently as deemed necessary by either party, and the responsibility to review and discuss any concerns either party may have regarding the operation and administration of the employees' welfare benefit plans available to active and retired members of Local 100 and their dependents. To consider and discuss any administrative issues regarding participant accommodations, example, request to transfer between available plans outside the open period, and to review and where deemed appropriate by both parties to address concerns directly to the carriers about the denial of coverage for medical services or equipment or prescription drugs." So what's significant about what's in the contract is that anything regarding health benefits, the union and the MTA must meet 4 times a year or more frequently. If the union is on the up and up and they not selling out the retirees or the future retirees, where are the minutes for these meetings, right? There should be minutes for these meetings. And it specifically says who's at the table: the president, which is Richie Davis, the secretary treasurer, which is John Chiarello, and the member services coordinator or director, which is Chris Lightbourne, right? There should be minutes on these meetings, at least 4, at the least. And if there's not, that's an issue. The union should be able to provide this information for the members, right? If they are on the up and up. If they're not on the up and up, they're not going to provide the minutes to the members. That's where things get a little shaky because they are not being honest.
You sit on a throne of lies.
So in conclusion, the union may be right. Our version of Medicare Advantage may not be what the city got. But one thing's remain constant. Aetna Medicare Advantage does deny claims. They are a for-profit company. And in order for them to make a profit, they must deny your health. And in a lot of our work environments as a transit worker, we develop cancer, lung diseases, high blood pressure, bad backs, bad knees, and a host of other ailments. Do you want a for-profit healthcare company to be the deciding factor whether you live or die? If you don't want that, I advise you to vote no and send our union back to the table and make them get this right. And I'm going to leave y'all with this question right here. Where is the lie?